government shutdown and your social security check or your retirement application or survivors or disability, or if you need a new social security card or whatever the case may be, what will happen during a government shutdown? How do I know? Well, my name is Ed Weir. I ran the third busiest social security office in the country. So I've been through quite a few government shutdowns, and many moons ago when I was in the Marine Corps, a couple of shutdowns there as well. So I'm going to tell you exactly what you can and can't do during a government shutdown. This is also a live Q&A. If you're new to my channel, I do a topic of the day. That there was supposed to be another topic today, but considering the government shutdown, I kind of changed it to the government shutdown. So I'll talk about that, and it should only take about 10 or 15 minutes, and then I'll get to the live Q&A. So if you have any questions, let's make sure. That's what I'm doing in my semi-retirement, is making sure your social security check is correct, or if you're about to file for benefits, that you don't make a mistake, because social security is not forgiving. You make a mistake, it'll affect your benefits the rest of your life. And there's all kinds of different changes. We've got the trust fund, got the solvency, we got the new president coming up soon. So we've got a lot of changes going that are going to happen very, very soon. So I'm going to keep you all up to date on all of that. Okay, enough stalling. Let's get right into the government shutdown and how that's going to affect your check. Social Security, most of the employees in Social Security offices are considered essential workers. So in terms of your check and everything, it's going to come as planned. The Department of Treasury, those checks are automatically sent out. If you're getting the old-fashioned paper check and you didn't get it for whatever reason, offices as of now will be open. There are some leftover card centers, Social Security card centers. If you need a new Social Security card or something like that, that is not considered an essential service. You can get an exception if you say, okay, hey, I'm getting a job. I really need the Social Security card, or I need the Social Security card for a newborn baby so the child can apply for benefits or something like that. The Social Security cards are okay. What about retirement applications, survivor claims? All that is pending. Again, those are essential services. And actually, because some of the other services are not going to be provided, those employees that usually do the Social Security cards, which makes up quite a bit of an office's workload, might be kind of resent to other areas to help those out. So your Social Security benefits might be uh, adjudicated quicker than normal. Medicare, same type of situation. So if you already have an appointment scheduled to file for Medicare, retirement benefits, survivor benefits, or anything like that, if you have a disability application pending, the at the DDS, those are actually state agencies. It's paid by federal money, but it's a kind of a state agency. Those should continue. That doesn't really affect unless there's a state budget crisis as well. What about all of the stuff that's going to be coming? The COLA increase, the cost of living allowance, what it's going to be this year, it's 3.2%. How much is it going to be for next year? You see all kinds of craziness out on there on the internet. Everybody saying, oh, it's probably going to be this much, probably going to be this much. Nobody knows. And then until the Department of Labor Statistics does their calculations, and that doesn't end until September 30th. So the new COLA increase determination come out in the first week of October, and all the other ones about the annual earnings limit, the substantial gainful activity, how much will Part B premium, all that will be coming in the next few weeks. I'm going to do a series of videos on that. You're going to know the numbers. Everybody and their mother, as they used to say, will tell you the numbers of Part B premium and stuff like that. But I'm going to do a series of videos to kind of get into it to show you how to make sure you're getting everything you're entitled to and what those numbers actually mean. One of the problems is Social Security is at a 27-year low in terms of staffing. You take your claim, and unfortunately, the staff doesn't do a great job in explaining all your rights and responsibilities to make sure you don't get an overpayment or get in trouble or anything like that. So I'm going to do a series of videos to make sure you're getting everything you're entitled to, or if you're about to file. Another thing that's coming up is the Medicare season. So if you have a Medicare plan, the Medicare Advantage, the Part D plans, those are only good for 1 year. So the new plans come out October 1st. And if that's during a government shutdown, that shouldn't affect the government shutdown. You can change your plan starting October 15th all the way to December 7th. Hopefully, Medicare will still be there in terms of processing all of those paperwork, but it might be a good idea to, kind of make your appointment. I've actually put together a team because I was tired of Medicare agents and brokers out there doing the wrong thing. So I put together a team to help people throughout the country with all things Medicare. So if you need help, I'll throw up my phone number, email, but you can also scan that and they can help you out, find the best plan for you. Make sure you're in the best plan for 2025. All right. So I already see a whole bunch of questions about the government shutdown. So let's answer specific questions. Let me go ahead and get rid of this. We'll pop up. Oops. We'll pop up the first question. Um, let's see here. So I have congestive heart failure and fluid buildup around my heart. I'm going to take medicine the rest of my life. Okay. Will I be eligible? Yeah, I get this question all the time. I have this or this disability. I have this health issue. And am I eligible for Social Security disability? Nobody can tell you, you know, right off the bat. If you have, stage 4 cancer, then yes, you'll probably be approved the first day. But anything like that, I would apply. I did a series of videos on applying for disability. Let me go ahead and pop up those videos so you can see. Based on, I've taken hundreds of thousands of disability claims in my tenure at Social Security, and so these are the videos. So watch these videos. And it gives you all kind of inside scoop about how to file for disability, tips, tricks, and secrets, medical records, how to deal. Do you need a lawyer, and all that? So make sure you check out those videos there, and that'll help you with the process. And good luck. Again, I used to, everybody at Social Security used to tell people, yeah, you should get an answer on your disability, the initial answer anywhere from 3 to 6 months. Nowadays, everybody's being told 6 to 9 months because of the staffing is so low. Miss Lady T, hello, thank you for your help. I just turned 60 this month. I am on SSI and I was married for 20 years to my ex-husband. Can I go now and ask for spouse support at my age? And ex-husband. So you're 60 years old. If your ex-husband is still alive and kicking, then no. For survivor benefits, you can be 60, but that person has to be deceased. So it sounds as though they're out there still alive and kicking. So if you're on SSI, actually SSI, the Supplemental Security Income, which is the welfare program that Social Security administers, they make you sign up for those extra benefits when you hit 62. But if your ex-spouse is deceased, then you can start at 60 years old. Okay, here's a question on government shutdown. Will the government shutdown effective appointments to reprocess survivor benefits that were supposed to be processed a few years ago? They lost that claim. If something was supposed to be processed a few years ago, a government shutdown is not going to make any difference. So they've lost that claim. So I'm not sure what's going on. A survivor's claim, I've taken hundreds of thousands of survivor's claim, and if you have all the documents, the marriage certificate and divorce decree, or the divorce, the death certificate with your name and you're the surviving spouse, those take 5-10 minutes to adjudicate and approve and get your money on the way. So it doesn't take 2 years. So something somewhere, they have lost your claim. So I would reach out to Social Security, and you're going to have to probably file again because your appeal rights are only for 60 days. And yeah, you've lost your appeal rights, unfortunately. Let's see here. Waiting to hear words of wisdom at 6 p.m. Okay. All right. I am here. Yeah, countdown to the, I wish politicians would do their job, but I guess we can't expect, I guess that's their job, is to be politicians, right? Trish, husband is 70 and on Part A Medicare and SSI only. I am 63 and will be changing jobs next week. There will be a 65-day gap to be covered under COBRA until the new insurance kicks in. So yeah, your husband, SSI is the welfare-based program, so it wouldn't be eligible for Medicare under SSI. So, but you mean regular Social Security. Everybody makes that mistake. Yeah, you have, when you turn 65, you have essentially 7 months, 3 months before, the month, and 3 months after to sign up for Part B without the penalty. Does he have to? Oh, okay, the second part of this question. Does he have to select his Part B supplements now, or can he be covered under COBRA? Yeah, COBRA is not um, eligible coverage in terms of special enrollment period until my new employer funded insurance kicks in. Think we've okay. All right. So when you lose your health insurance from work, so you had work and you're losing health insurance, he and you are losing health insurance. So at that time, you have 8 months to sign up for Part B to avoid the penalty. I always recommend don't wait the 8 months because that's when you get sick or fall or something like that. But in your particular case, that's good. You have 8 months to sign up for Part B. And it sounds like before the 8 months is over, you're going to be transitioning to a new job and he's going to have health insurance again. So if that's the case, you are good. Kevin, ex-spouse, if I remarry prior to age 60 to a different person, then divorce again after 60, am I now eligible to get ex-spousal benefits if I was married to my first spouse at 10 years? Yes. If you're now divorced, then you are eligible for benefits again. So you can go back to your first spouse, second spouse, third spouse, whatever the case may be. Remarrying after 60, you probably heard about that. That's surviving spouse benefits. So if you're receiving surviving spouse benefits and you remarry after 60, doesn't stop your benefits continue. So that's not an issue. Now let's see. Question on WEP and GPO. Oh, those are always fun. If I have a pension and I die and my spouse files for the survivor benefit, doesn't my GPO die with me and my spouse gets a recalculated? Okay, so for those people that don't know WEP and GPO, so Kevin worked for a state, city, local, county agency that did not pay into Social Security, did not play with Social Security. And so if it's based on your earnings and you pass away and your spouse did not, doesn't have that non-covered pension, it won't affect them. Your earnings won't affect them in terms of a GPO. It's only their earnings. However, your benefits are recalculated because of that windfall elimination provision. So they're already recalculated there. All right. Let's see. Look on this other format. Any questions? All right. Let's see here. All right. Make sure we get all the questions. Had a bunch of questions yesterday. Weren't able to get all of them. So hopefully those people came back today. Amelia got injured at work and was on L&I for 3 years. Would this count as 0 because I didn't work for 3 years? Okay, I'm not sure what you mean by count. Yeah, probably you're asking about how much your benefit amount will be. If you did not work and no earned income, they did not pay FICA tax into wages or net income, then that's a 0 year. So anything like an inheritance or pulling out a 401k or short or long-term disability, that's not considered earned income. So that will affect your future Social Security benefit. Tony, for an SSDI, Social Security Disability Insurance new claim, does the VA medical records get to SSA automatically, or do I submit VA medical records myself and any delays? I did my video on disability. I talked about medical records and whether you should send them yourself or whatever the case may be. But yeah, it's all automatic. All you have to do is when you file the disability claim, you tell them, hey, my records are at the VA, they're at workers' comp, they're at this hospital, they're at this doctor, and you sign this little document. It's called 827 authorization to release medical records. And the DDS, the state agency that does the medical determination, they send that request to everywhere. The VA is good because the Social Security system and the VA system kind of talk to each other a little bit quicker. So if you have medical records at the VA, it actually gets to Social Security a lot quicker than, Dr. John down the street. Valerie, I get SSA survivor benefits. I'm 65 on February 25th. I would like to check if I am getting the correct amount and I'm paying over the federal back 160. Yeah. Your survivor benefits, you're not getting the full amount because you didn't wait till your full retirement age. You got it early, which no problem with that, obviously. But you're getting survivor benefits and you're not getting benefits on your own record, which is a strategy a lot of people use. They go ahead and get the survivor benefits while they wait for their benefits on their own record to increase. Yep. I'm not sure about the paying over a federal back of 160. Not sure what the federal back of that means. You have a back pay or you owe the IRS or something. Cheryl, hello. I am on SSDI. Can I be a beneficiary for someone else? The current beneficiary is not using his SSI on him. She keeps his money for her use. Yes, unless you're talking about can you help someone else? It's called a representative payee. Yes, you can be a representative payee for anybody, but you can't have your own representative payee. So representative payee is, so for instance, somebody's on disability or elderly or some other type of issue that they can't take care of their own benefits. Then you go to Social Security and you file a representative payee application. And so you're the person ultimately responsible to make sure those benefits go for that person's welfare. If you have your representative pay yourself, they're not going to make you a payee for someone else because you can't take care of your own benefits. But I'm sure that's not you. Yes, absolutely. So representative payee, sometimes it requires, children, obviously that's a slam dunk, but an adult, you need some type of doctor's note usually, or the person with you, and kind of the Social Security employee can kind of check out that, talk to the person and says, okay, well, why do you want this person to be the representative payee? And so you can do that. And that is something that's important that will not be affected by a government shutdown. That is consensual. That is considered essential services. All right, let's see here. I'm on disability Medicaid and Medicare. Just turned 62. Do I have to sign up for Social Security? You're already on disability. Yep. So you're already on Social Security, Social Security disability. What you're asking is, should you also file for retirement benefits? No, because you're already getting the max amount. You're already getting your full benefit amount, your full PIA, the primary insurance amount, the amount you would get at your full retirement age. You're already getting that. So some people do, less than 1%. They say, I don't want disability on you anymore. I don't want all the, the work limitations. I don't want to be called disabled, whatever. I want to just file for regular retirement. So they cancel disability and they go to retirement benefits. But it's a 30% reduction. So you're losing money. So, but yeah, not many people do that. So nope, you're good. But on that, if you're on disability, I like to mention stuff like this because there's so many people out there missing money. When you turn 60 and you're on disability, check to see if you're entitled to any survivor benefits. Anybody you were married to passed away. You can get disability benefits, keep your Medicare, and receive survivor benefits. Now that you're 62, were you ever married to anybody, divorced, and you were married to that person for 10 years? You can get spouse benefits on that person's record if your benefit amount is less than half of theirs. Spouse benefits up to 100%. And then when you hit 65, you should check to see if you can switch your Medicare Advantage plan, which most people under 65 have a Medicare Advantage plan. See if you can switch it to a Medicare supplement plan. Check out the options. It's not for everybody. And then when you hit your full retirement age, you're no longer receiving disability benefits. You're automatically switched to regular retirement benefits. How can I share this with my friend so she can talk to you? Yeah, I do a limited amount of just 1 or 2 or 3 a day of private consultations that I charge for to pay for everything else. 99.9% of my help is free. She can just in the chat at the very top there's a little link. And then on the description below, there's a little link and you can schedule an appointment. So. All right. No, never mind. I figured it out. Okay. She figured it out. Terry, yes. Where to turn? Applied for Part B. Husband retired. No one can find my application. I'm in the no penalty 63 days to apply for Part B and D. Spent hours on the phone, local and national. No help whatsoever. Yeah, that's unfortunate. So, so it sounds as though you're new to Medicare at 65. And if you're not receiving Social Security benefits, then yeah, you actually have to file an application and everything. So yeah, it sounds like someone along the lines lost your application, or if you're after your 65th birthday, then you filed those two forms, the 40B and the 564, and those, yeah, those are probably very lost. Um, Local and national, no help whatsoever. I would, um, because I just did a video yesterday about dealing with Social Security. I would call another office, the other office in your town or something like that, and they'll say you're not our office. Your office is across town, and I always say, well, you say, does your building have Social Security Administration outside in big letters on the outside of the building? And I said, yes, it does. Well, then you you are my office. So I would call another office because all of the systems are computer paperless. I actually helped design the paperless system inside Social Security. So, and you can see that from anywhere in the country. So another office anywhere in the country can look and see what's going on with your application. So you know, try to find maybe a smaller office in your state and give them a call and see if they can find it. How do I apply for my spousal part of my husband's Social Security? I started my own 2 years ago, and my husband started his a few months ago. Yeah, you should have filed for benefits when he filed. So, what usually happens is your husband files and it's a phone appointment, and he files and then he hands the phone to you, and then you file for spouse benefits on his record. So but yeah, you can go ahead and call the 800 number. You might be able to do it online, but call the 800 number and schedule an appointment. The appointment won't be for about a month or two, but you're protected for this month, and they'll probably start your benefits. um, yeah, they'll probably start your benefits the same month your husband started his benefits. Yeah, I'm surprised yeah, that's a failure of the Social Security office, because that's if your current husband, I'm sure your current husband said, "Yes, I'm married." So they should have sent you a letter that said, "Hey, you're supposed to file." Or they should have said, "Oh, you're married? Let me check your wife's wife's benefit amount. Oh, there's less. Her benefit amount is less than half a year, so she's entitled to benefits. Is she there?" That's how they should have done it. They should have taken it right then and there. They always did it in my office because my office was awesome, but unfortunately, yeah, a lot less staff nowadays. K Wolf, hi. I'm waiting. They're not office. My office was awesome because of me. Their office because they were awesome, awesome people. I'm waiting on Social Security disability ALJ hearing date. Will that be affected? No. So what she's saying that she filed for disability benefit. She went the initial. It was denied. She filed the reconsideration. It was denied, and now she's been waiting a year or 2 years to get her day in front of a judge, and she's waiting for her date for that hearing, the administrative law judge. But that won't be affected. They're considered essential workers as well. So let's see. How can I find out if the WEP has been applied to my German pension? Yeah, just it's pretty easy. You go on to your Social Security SSA.gov website amount, and it'll say X amount. And if you're not getting that amount, obviously, if you're retired early, you're not getting that amount, but you can figure out almost immediately whether the WEP elimination provision was calculated. Will a government shutdown mean current recipients will not get their checks in October? Nope. All the checks are going out. Everything is good in that respect. There would be, yeah, Social Security. Could you imagine if the government shut down and then, yeah, 70 million Americans wouldn't get their checks? Yeah, I think politicians would be running for the hills, which I think they should be anyway, because they need to do something on this customer service. So we need to make sure politicians, as I always say, these politicians, they're always happy to put on a hard hat and get a shovel and get these giant scissors and go out there and say, hey, look what I did for your district. Well, go down to Social Security Administration, look at that line at 9 o'clock in the morning, call Social Security and find out, how many hours you have to wait. And then sometimes you get an incorrect or incomplete answer. So take your little hard hat, take your little funny big scissors down to your local Social Security office in your jurisdiction and improve customer service. Okay, there's my diatribe. Okay, let's see here. Tammy, will I receive the Advantage plan change in the mail or online on my Advantage? You'll get the it's annual notice of change. Everybody's getting that right about now. So if you have a Medicare Advantage Part D plan, you're getting the annual notice of change. It'll tell you, hey, next year your plan is changing this month. And in 2025 is the big year. That's yeah, there's all kinds of different stuff. There's plans that are leaving Missouri, Florida. I just saw another big company that's really they're going to be dropping 10% of the people on their particular plans. I always try to avoid using company names. I always like to stay neutral because you're like, what company should I do? What company should I do when I do a Medicare Advantage or a Part D or a Medicare supplement plan? Nobody can tell you that. It's your specific situation in your specific area. Your next door neighbor might have company X, but that's great for that person, but it's not for you because that company doesn't have your doctors and your prescriptions are too expensive in that company. So your company is completely different. And next year, your company might be completely different again and your plan might be different again. So it's important really this year. I mean, I can't stress it enough. It's really important this year to check your plan. And I put together a team that can help you, and it's a free service, so they don't charge you anything. So just give us a call and say, hey, when the new plans come out in October, set me up and let's do a review. And if you're in the best plan for 2025, then you don't have to do anything. So my claim was lost, so I have to reapply. Can I do that during the shutdown? Absolutely. That's considered essential services. So you are good. Barb, I turned 66 in November and want to wait until next year to get my Social Security benefits because I want 2024 wages counted. My last day of work was, yeah, I wouldn't even wait on something like that. Yeah, those wages are going to be calculated anyway. It doesn't matter. So you go ahead and, if you want, start your benefits 66 in November because those wages aren't going to count until January anyway. So you get your check for November and December. And then once you do your taxes in next year, in January, February, March, April, you do your taxes, you notify the IRS notifies Social Security, and Social Security automatically takes those wages. And if that's one of your high 35 years of earnings, they recalculate your benefits and adjust your benefits going all the way back to January. So even if they don't do it until July, and if it's a $10 increase, then they'll give you that, 6 months, $60, you'll get a $60 extra because you get 10 months or $10 for those 5 months. So that's automatic. So I wouldn't, if you want to wait till January because you want to wait till January, that's fine. But there's no reason to do it just because you want your wages because they won't be included until you actually do your taxes and everything. And they will be included automatically. So it doesn't really make sense. But if that's what you want to do. Wendy, I am 61 on SSDI. I want to apply for my ex-spouse benefits to get more money. I have to be 62 to get his benefits. Correct. I will be 62 in June and he will be 62 in October, or I have to wait for him to be 62. Yes, he has to be 62. Your ex-spouse has to be 62 for you to collect benefits. And I just was reading through my comments today, and this is called independently entitled divorced spouse benefits. I'm looking for the reference here. Independently entitled divorced spouse. So there's a lot of people out there that are not getting the money they're entitled to. Like for Wendy here, she is, let's say, 62. Her ex-husband that she was married to for 10 years that's more money in terms of that the ex-husband's benefit amount is more than twice her full benefit amount. So she's probably entitled to benefits on that record. And there's a lot of people out there that say, well, yeah, he or she, my ex, made a lot more money and there's money there, but they're not filing for benefits probably just to spite me. Doesn't matter. It's called independently entitled divorce spouse benefits. And unfortunately, I talk about it all the time, but I also talk about the fact that Social Security, come on, Social Security. People are providing the incorrect information. You call, and the people at the front windows that pick up the phone and the people at the front windows in the office are the generalists. They're not Title II. It's called the Title II of the Social Security Act. They're not retirement specialists. So unfortunately, they're giving out incorrect information. So I just saw a YouTube comment this morning that says, Yeah, I did what you said. I went into the office and they said my ex has to have filed before I can receive benefits, and that is 100% incorrect. So I just added the policy reference, over 20,000 pages of Social Security policy, and I just added that policy. It's called IEDS, Independently Entitled Divorced Spouse. So the person that left that comment, if you're watching, click that, print that off. For you, the independently entitled divorced spouse, maybe save that reference there, and that way, when you go into Social Security, you won't be, yeah, they won't give you incorrect information. I wish Social Security would do a little bit more of, yeah, training on that. Um, but again, they're barely, you know, getting above water right now. All right, let me we'll go back to if I jump in your questions, I apologize. I've got a lot of questions here. I'm trying to get people that have never been here before, never asked questions. Um, let's see here. Patty, welcome, Patty. 66 in January, plan to continue work. Can I take my reduced Social Security from January 25 until 6/25? On 7/25, I'll take FRA survivor benefits. Will they be reduced because I take mine early? No, your benefits are reduced because you're going to take your benefits early. But yeah, you can go ahead and get your benefits and then switch to survivor benefits if it's more. But what I would consider is taking the survivor benefits early, even though it's, maybe a little bit less, and then not taking your own and letting your own increase until you're 67, 68, 69. It'll continue to increase up until you're 70 years old. So that's maybe something you should check out. So call Social Security, set up an appointment, and get the numbers and say, hey, if I take survivor benefits now, how much will it be? If I take my retirement benefits, how much it will be? If I take survivor benefits now and then I wait until my full retirement age to switch over to my own, how much will it be? So I would check out those two options and see which one is the best strategy to get the most of your money back. Terry, do you know which Medicare action is best if you have to go out of state to see a surgeon because he's the only one that you can do on your back? Yeah, Medicare supplement plan, one of the N or Gs. There is no networks. Well, I always say, if you have a Medicare supplement plan, plan F and N or G, your network is America. So any doctor or hospital or clinic in the country that takes Medicare accepts those plans. If you have a Medicare Advantage plan, then you have a limited network, an HMO or PPO or whatever the case may be, and then you have prior authorizations. But if you're already in a Medicare Advantage plan, and you can't switch to Medicare supplement, then yeah, get your doctor that is, your primary doctor. If that's the person that says, oh, you definitely need to see this person, maybe that doctor, that surgeon in another state is part of your company's network, or just, different network. So I would reach out, and, you know, uh, check to see if you can get that type of approval to go see a surgeon in another state, another area. So, is the SHIP program good? So, state health insurance program, they're kind of volunteers throughout in each state that helps you with, health insurance type stuff. Um, I love volunteers. Volunteers are awesome. I wish more people would volunteer, but they're volunteers. And sometimes they're awesome. Sometimes, yeah, not so much. When I worked at Social Security, we used to send people down to the ship all the time, and yeah, it's a hit and miss, unfortunately. So, but I'm never going to say anything bad about volunteers. On SSDI, a person cannot get divorced spouse benefits, can only get deceased spouse. Nope, they can get divorced spouse benefits as well. If their benefit amount is less than half of that person's benefit amount, absolutely, they can get it at 62 years old, or they can get surviving spouse benefits. So yeah, a lot of people are not getting the money they're entitled to. That's why I'm doing these crazy videos and doing these live Q&As to get people the benefits they're entitled to. So please subscribe, share, and like, and all that kind of good stuff, so it goes out to more people. But yeah, a lot of people are not filing for survivor benefits and spouse benefits and all that money that they need, because they think, well, if I get spouse benefits or survivor benefits, that's going to cancel my disability. And sure, it's more money on spouse benefits, but that's going to cancel because I will no longer have disability. I will no longer have Medicare. And that's not true. You can have disability and care will continue, and you can get survivor benefits and spouse benefits on top of that. So, and then if you have, you get your Medicare and you get your Medicare Advantage or Medicare Supplement, or if you're having a hard time paying for those, the Medicare Part B premium, you can get Medicaid. And yeah, so there's so many pieces of the puzzle people are missing because the whole system is just way too confusing. 20,000 pages of policy. Yeah. I am 71 years old. I received Social Security. My husband passed away in 1999. I didn't file for benefits for my children. Can I still file for my husband's benefits? Yeah, if your benefit amount is less than your husband's benefit amount, I would definitely call up because with survivor benefits, you get up to 100% of that person's benefits. The children thing, yeah, it's not really relevant. If you get, some people think if a parent passes away and the children get benefits for a few years, that kind of sucks out all the money out of that particular account. No, that's no. You can still get survivor benefits on your own. Decade, 2 decades, 2 decades later, it's not an issue. So I would call up Social Security and give Social Security, the people that answer the phone, give them your husband's information. If you got the Social Security number, awesome. If not, just tell them the person's name, date of birth, as well as where they were born, and the person on the phone will be able to find the Social Security number, and they'll tell you whether there's any more money there in terms of, if your benefit amount is 1,800 and your surviving spouse benefits is 1,700, that means there's no more money there. You're getting a higher amount. But if the surviving spouse benefits is 2,000, you got another $200 coming there. So they will make an appointment for you. So go down there and get that money and come back here and tell us whether you got some more money. We always like to hear that we found some money for people. My earnings record has been corrected by the Social Security office, missing 12 years. How long does it take to let the processing center PC8 OIO work on this? Will my SSDI increase? Yeah, if they corrected it. So yeah, the PC8 is a processing center. Some people call it process payment center, but it's the OIO is Office of International Operations. They also do earnings record corrections. So good on you, Max. So Max did the right thing, which I tell people all the time. Check your earnings record, because that's going to determine how much you're going to receive for the rest of your life, is how much you're actually paid into Social Security. So Max had a bunch of earnings there that were not correct, and he provided the documentation, or they found it in what's called a suspense file, whatever the case may be, and they're correcting it. Unfortunately, Social Security is understaffed by 27-year low in staffing. But once they do it, yes, your Social Security disability will increase. If those 12 years are part of your high, 35 years or whatever the case may be. So if, those 12 years are corrected, but you only made $500 those years, then probably not much. But yeah, it really depends on how much you paid each year in those particular years and how much all your others is. But yeah, if that's, probably if you're receiving SSDI, yeah, that's going to increase. Definitely not going to decrease your benefit. 100% won't decrease your benefit. So congratulations on, getting that fixed. Awesome. Carletta, I paid into FICA. Is it still taxed as Social Security? I just retired in June and they have not calculated all earnings of 2021. So is it still taxed as Social Security? Yeah, yes. If you start receiving Social Security benefits and you work, you will continue to pay the FICA tax. You just retired in June and they have not calculated the earnings of 2021. That doesn't make sense. Social Security, if Social Security got those numbers for 2021 and they're on your record, then it's automatic. It's been calculated in there. It's in there. But if you go into ssa.gov and it shows 2021 zero, that means, there's somewhere along the line you filed at the IRS, somewhere it's stuck because it hasn't gotten a Social Security yet. But as soon as it shows up in ssa.gov in 2021, X amount for 2021, then it's already calculated in there. That's automatic. The computer system does it automatically. All right, I'm jumping around getting new people here. Patricia, both X and I are age 67, and I receive a Social Security income. My question is, can you qualify for spousal benefits? If not, what could possibly be the reasons for Social Security to deny it? Um, yeah, if your ex, you were married to the person for 10 years or longer, and you're not currently married, then you're entitled to those benefits. So they wouldn't deny you in that case. However, if there's no money there, in the sense that your benefit amount is not less than half of his, then you're technically entitled, but there's no more money to pay. So they deny you because there's no more money. And this is another reason a lot of people, walking around out there that are having a hard time because they get incorrect information, like Patricia here. So calls up Social Security and says, "Am I entitled to spouse benefits?" And I say, "Were you married 10 years?" "Yes, I was married to 10 years." "Are you currently married?" "No." "Okay, yes, you're entitled, but is there any more money there?" So if your benefit amount is, let's say, $500 and your spouse's benefit is $900, your benefit amount is not less than half. But if yours is 500 and his is 1500, then you're entitled to some more money. But the problem is because living spouse benefits are up to 50%. The problem is Patricia is told, "Oh, you're not entitled to any money on your ex-husband." So she thinks she's never entitled to benefits on her ex-husband. And then 10 years later, something happens to him and he passes away. Now it goes from 50% to 100%. So she would be entitled possibly. But there's a lot of people out there that are struggling and there's money sitting there waiting for them. And so please, let's go out there and talk to your neighbors and relatives and stuff like that and say, "Hey, how's your Social Security? Does it look like were you married to someone, and have you ever checked Social Security and something like that?" So um I try see, there's something issue with my internet. Can you please contact? I tried to reach you on your website, but there was an issue from you. Yeah, yeah. This is the place to contact unless you want to set up an appointment. Todd, my benefit was impacted by WEP. Will my surviving spouse benefit be impacted by WEP too, or will I simply receive my spouse benefits? Um, so let's see. So I'll make sure you're talking about two people here in two different programs. So your benefit was recalculated based on the windfall elimination provision. Will my surviving spouse benefit? Yes. So if you're also you have a deceased spouse, then that is called GPO, government pension offset. So that non-covered pension, 2/3 of that will affect your benefit from a deceased spouse. Let's see here. Colleen, if I'm on disability and my husband is 62, can I get Medicare? No, if you're on disability, SSDI, not SSI. SSI is the welfare-based program, but SSDI, if you're on SSDI, you get Medicare after being on SSDI for 2 years. So the 25th month, your Medicare starts automatically. Um, but if you're on SSI, um, if your current husband is 62, then you can file for spouse benefits. And if you're 65, but if you're 65, you get Medicare on your own. So you have to be 65. So let's see, Lori, I had Part A. I am 68 and had work insurance. Yeah, if you had health insurance from work and you're happy with it and your employer has 20 or more employees, you do not have to sign up for Part B. So once you stop working, stop receiving health insurance from work, then you go ahead and sign up for Part B. You have 8 months, technically. I wouldn't wait the 8 months, but Karen, 65, disabled, waiting for SSDI. As September 1, Medicare Part A, B, D, and Medi-Cal, forcing me to join managed care. When Medicare ends years from now, can I switch Medicare to a sup without underwriting? You're 65. That's probably if you've already got B and you're already 65. But California is kind of strange. They've got different anniversary rules and birthday rules and stuff like that. So you can reach out if you have a good insurance broker, Medicare insurance broker. They can walk you through it, or you can call us up and we can walk you through the California regulations. The Medicare supplements are regulated by particular states in terms of when you can enroll and everything. So each state does it a little bit differently. No, that's not true. Someone receiving SSDI is entitled to collect IEDS from an ex-spouse. Yes, Deb. Deb is always on here making sure everybody gets the money they're entitled to. We have such an awesome community. Next May will be 65, worked a few years only. Yeah, so if you're not entitled to Social Security in terms of the 10 years, 40 quarters, then yeah, you wouldn't be entitled to Medicare, or unless you can file on a survivor claim or a spouse claim or something like that. Sheila, I'm confused. Well, welcome to Social Security, unfortunately. Yeah, it's crazy. I had a SSI application that was denied due to my husband SSDI income. Had SSDI in place since last year. Then my husband passed. Can't get spousal benefits. All right. So yeah, SSI, because that's a welfare-based program, it looks at your income and resources, including the people that live in your house, your relatives' income and resources within reason. Um, so they denied it at that time for low, over income. But if he has since passed, um, if he passed in August, so you would have to be 60 years old to go ahead and get surviving spouse benefits. So if you were married to the person for at least 9 months, then you can get um, surviving spouse benefits. If the surviving spouse benefits are more than what you're currently receiving from SSDI or wherever you're receiving those benefits from. Karen, since Social Security said my full retirement age was September 2023 survivor benefits, why are they paying me starting November? And will I have to pay back for working last year? Yeah, work last year, it doesn't matter. Work up until, well, okay, you're talking about 2023. So um, if you start your benefits in September, they don't care what you worked in terms of before that, January to August, it doesn't matter. They only look at your benefits after you start your benefits. But your FRA, your full retirement age, was September 2023. So you don't have a earnings limitation at all. You can make $1 billion a month after you turn your full retirement age, and there is no, $1 for every $2 being withheld and all that kind of good stuff. Esther, I really appreciate these videos. Great, awesome. I have really done my homework, and today when I talk to Social Security, think I'm surprised the person on the other end because I knew things I didn't know. I knew she didn't know. Yes, yes. All right, good deal. Good deal. Yes. Um, yeah, unfortunately, I wish that wasn't the case. I wish they knew more than what they know, but yeah, they're hiring people and they're sticking them out the windows before they're fully trained. It takes a good 2 years to fully train. Again, 20,000 pages of policy. So it takes a couple of years for them to be fully trained. But they're so short staffed. They're like, hiring them off the street, giving them a couple of months and say, hey, go at the windows and see how much trouble you can cause. Yeah, that shouldn't happen. But Terry, how do I know if my ex paid enough into Social Security because he worked a lot under the table? And what if he never files for Social Security? Can I still file? Yes, if your ex is at least 62 years old and you're 62, then you can go ahead and file for spouse benefits. And whether they paid under the table, that's going to affect the person's primary insurance amount, which determines how much they will receive when they retire or whatever. And it also affects how much you will receive in spouse benefits. So yeah, you can't do anything about them not paying taxes and doing under the table. So, Doctor, I'd fully agree on your diatribe. They need to do the job they promise and help people. Yes, yeah, I get up on my soapbox. It's like, come on, we go down there and we need to come up with some giant scissors and go down to your politician's office, your congressperson, senator, and say, hey, I see you out there using these giant scissors. Can you go down to the local Social Security office 9 o'clock in the morning on Monday and see that line? Why don't you cut a ribbon down there and put some extra staff in there, help with the computer system, or make this thing a lot easier, so Ed can retire again, if nothing else, right? Esther, I talked about the widow's cap rib limb. She said she'd have to look into that and had to put me on hold. Yes. So you talked to somebody on the phone and you gave them an advanced question. Yes, advanced mathematics, widow's cap, the rib limb, and yes. But that's to be expected. I talked about this yesterday in my video. The people that answer the phones in the 800 number, the people at the front windows are customer service representatives. You got a direct deposit if you want to, print out of your work history, stuff like that. They're not experts in retirement, survivor benefits, disability, SSI. You actually have to talk to somebody, a claims specialist, to get that. Brenda, I'm new. I've been on SSDI since about 2012. Also survivor benefits. See, everybody? She is receiving disability benefits and she's been receiving it since 2012. So I'm sure Brenda has Medicare unless she's getting health insurance from her spouse. But she's also receiving survivor benefits. So that's two checks, disability check and a survivor check. They put them together and one kind of, deleted from the other, subtracted from the other, but those are two checks. So Brenda did the right thing. Awesome. But I just turned 63. Have I been getting his retirement or do I call now? No, if you're receiving, if we're talking about the same person, if you're receiving survivor benefits from that person, then that's, that's his retirement, essentially. His retirement turned into survivor benefits when he passed away. 96 likes and 390 watch. Come on. Yes, please. More people like. Thank you very much. So this goes out to more people. Yolanda, hi, I'm new here. Love your information. You give us all your knowledge doing the work. Thank you. Hey, you're welcome. Welcome. Thank you for taking the time to write that nice note. Sandy, I got my two sisters' spouse benefits. They would have never known about it. There we go. There we go. All the people that press like and subscribe and share. That's as I always say, I'm just sitting here, blabbing on for an hour. It's y'all that get this information in the hands of people that need it. That can get extra money. So awesome to all the people that up until now liked and shared. You're the reason those people got that money. Good on you. I will be 65 soon. Hubby is retired. I was a homemaker and now caregiver. How do I my Social Security, Medicare, Social Security? Yes. So so it sounds like possibly you not insured, you didn't have the 10 years, no problem. If your husband has to have filed. If your husband is currently receiving Social Security benefits, then you can go ahead and file a spouse claim. Doesn't matter whether you're insured or not. No relevance whatsoever. You just file a straight spouse claim, so you can start your money, and that includes Medicare. Or if for some reason, well, actually, you have to do both. You have to go ahead and start your money and Medicare at the same time. You can delay Part B if you want to, if you already have health insurance from his work, but it doesn't sound like it. So call Social Security and schedule an appointment for a spouse claim, or you can do it online. Max, thank you for your answer and advice. I involved my congressman and my record has been fixed within 3 weeks. I have nothing happening for 18 months. Wow, there we go. All right, more success stories. I like it. On my website, MyGovExpert, I've started putting some of the testimonials, the reviews on the website. So I appreciate y'all writing those. It helps everything out. There's so many cynical people out there like, who is this Ed guy? What the hell, who the hell is he? But cynicism is good. There's so much scams out there. Arlene, I am separated from my spouse and we're always files taxes separately. He is still employed. Well, I still need to pay taxes under $32,000 a year for myself, or do they look at him? Yeah, I don't do taxes. I never worked for the IRS, and I've been trying to cancel my IRS subscription for decades. But in terms of Social Security, doesn't matter. You're not divorced, so you're still a spouse according to Social Security, whether you live the other side of the world or whatever the case may be. How you file taxes, no relevance whatsoever. If you're entitled to spouse benefits or survivor and spouse benefits in the future, they don't care. Social Security doesn't care. You weren't divorced. Even if you were divorced, as long as you were married for 10 years, then you can still get those benefits. Let's see here. Terry, Virginia, Medicaid, Medicare only pays 80% Medicaid, the rest. Out-of-state surgeon, I'm responsible for the other 20%. Surgeon is not affiliated with any Medicare at all. Oh, then if the surgeon doesn't take Medicare at all, which probably about 5, 6, 7% of doctors out there don't take Medicare at all. Usually they're psychiatrists and podiatrists and stuff like that. But then unfortunately, sounds like it's out of your pocket. Do you know how much COLA is this year? This year, 3.2%. For 2025, nobody knows. But once the numbers come out in the first week or 10 days of October, I'm going to do a series of videos talking about COLA and the annual earnings limit and substantial gainful activity and the Part B premium, and not just giving you all the numbers like everybody does. I'm going to dig deep in it, and we're going to make sure you're getting everything you're entitled to, all the stuff Social Security should have told you when you first filed. Is there an earnings limit when collecting survivor benefits? Yes. Earnings limit for early, if we're talking about early retirement. So before your full retirement age, yes, there's a limit. This year it's $22,320. So if you're collecting retirement benefits early, spouse benefits early, survivor benefits early, they all have the same annual earnings limit. So, or monthly earnings limit. Let's see. My husband was divorced 2 times, and each ex-spouse collects spousal benefits. Do each of us 100% of his benefits now that he is deceased? Yes, up to 100%. It really depends on how old you are, and how old if they filed early than it. But they receive, yes, up to 100%. So you could have 2, 3, 4, 5 ex-spouses receiving same money from the same spouse. Yeah, it's interesting. But yep, one doesn't affect the other. Could you imagine if, oh yeah, you're receiving spouse on an ex-spouse that passed, but now that person married another person, and that person is now receiving benefits, so yours is going to be reduced. Oh my gosh, could you imagine the fights that would cause? Yeah, so I get $1,600 per month on SSDI, and own my home worth around 140. Can I get EBT and Medicare premiums paid for? Yeah, 1,600 is yeah. The home doesn't matter. Before I worked for Social Security, I worked for the Department of Social Services doing Medicaid and food stamps and stuff like that. So all states, they exclude one home and one vehicle. So yeah, your home doesn't matter at all. That's exempt. $1,600. It depends what state you are in. Some states are a little bit cheaper. In terms of, the states don't like to give out money, but $1,600 probably. So I would call your state Medicaid office, and what he's talking about, or he or she is talking about, is the Medicare Savings Program. So if you or someone you know are having difficulty paying for the Part B premium, the $174.70, have them call Medicaid, the state Medicaid office, Department of Social Services, whatever they call it in your state, and apply for Medicaid. And if you're approved, Medicaid will pay for your Part B premium. So you could have Medicare and Medicaid will pay for your Part B premium. And that means you will be what's called dual eligible. So you have Medicare and Medicaid. A lot of people think you can't have both, but you can. And because you have both, you can also sign up for what's called a Medicare Advantage dual eligible plan, which works well with both of those. And those are the ones you see advertised at all the grocery cards and help with electricity and stuff like that. People always ask me, are those scams? No, they are available. It depends on your particular area. The way they're advertised is kind of scammy in the sense that they, companies take one of those grocery cards, the best one in the country, that is only available in one particular area, and they advertise it to the entire country. And then you call them and they say, well, do you live in, Southwest Dallas, Texas? No, I don't. Well, sorry, you can't get it. And then they do the hard sell, trying to sell you something else. So that's a scammy way of doing it. But that's why I put together my own team, because I was tired of, anyway. Let's see here. We are running out of time. Let me get down to people I had never seen before, trying to answer some questions. The new people here. I was recently approved for disability, but they changed the date of disability. I have been out of work for 2 years. Why do you have to wait 24 months to get Medicare? I agree. Medicaid will probably say I get too much. Yeah. Yes, that's the regulation. When you're on disability, SSDI, you have to wait 24 months. You have to be on it for 24 months, which I think is terrible. I think if you're approved for disability, your Medicare should start the same month your check starts. We need to make that change. So contact your politicians, go down with your giant scissors. And anyway. Yeah, I agree. And then, yeah, Medicaid in your particular state might say you're receiving too much. They changed the date of disability because there's different. There's the EOD and the POD and the AOD. The established onset date, which is what they established your onset to be, and then there's the alleged onset date, what you alleged your disability started, and then there's the potential in terms of insured status and stuff. So, but you can appeal that date, and you say, no, I disagree with it. I think my disability benefit should have started 2 months or 3 months or 6 months earlier. You can do that. However, you're reopening the case. So you're going to appeal it and say it should have started earlier. And then you send it up back to DDS, and another person looks at it, and that other person, you never know. So that's, yeah, that's the risk. Hola, Dr. Ed. My Social Security benefit, as well as my husband's, was affected by WEP. I was told that I would not be eligible for any increased benefit, even if he should precede me in death. Is that so? Um, well, you will be entitled to more benefits if you're entitled to benefits on his record now, and he just passes, then your benefits will increase. However, they won't, because 2/3 of that pension you receive from that non-covered pension, 2/3 of that will offset that. So technically, you go from 50% to 100%, but then 2/3 of that will offset that remaining, the difference of the 50%. So yes, that sounds correct, unfortunately. Question I get all the time: do I have to claim bingo and slot machine winnings? I am 69 and my only income is my Social Security of $19.99 a month, and I'm single. No, unless you are a professional bingo and slot machine player, and that's what you do for a living as your business. So, nope, doesn't. It's if you're talking about early retirement age type thing. Oh, you're 69. No, if you're 69, you don't have the annual earnings limit, so that doesn't matter. In terms of the IRS, the IRS might say something, but yeah, that won't affect your Social Security check at all. You might have to pay taxes on it and stuff like that, but nope, Social Security doesn't affect it because but say for instance you were 64, it still doesn't affect it because that's not earned income, unless again you're a professional poker player and that's what you do for a living is play poker, and then that's your business, and so therefore yes, that will affect. But yeah, just winning something like that, you're good. All right, let's see here. We're out of time. Let me do one more here. I retired at 71 and I started receiving spousal benefits since I was 65. I retired with 36 years of the federal government. Well, when will my Social Security start? Um, so it started at 65. You're receiving spouse benefits. If you're asking about benefits on your own record, if your own benefit amount on your own record is more, I would call Social Security and say, "Hey, I've been receiving spouse benefits or divorce or probably surviving spouse benefits." If your spouse is alive, then there's no extra money there. But I would call because maybe you were born before 1954 and the law changed in 2016. So if you were born before 1954, call Social Security and find out if there's any more money on your record. But if you work for the federal government, maybe you're under the old system that didn't pay into Social Security. So, all right. Yes, we're out of time, unfortunately. So if I didn't get your question, please cut and paste it and join me tomorrow. And I will be back here tomorrow and do my regularly scheduled what I intended to do today. I'll do it tomorrow, but I'll also do a lot.